Good afternoon. My name is Kevin Stewart. I'm with the Episcopal Diocese of Milwaukee, and it is my pleasure to introduce John Chisholm, District Attorney of Milwaukee County. John has 25 years of prosecutorial experience and spent much of his early time as a line prosecutor trying to reduce gun-related violent crime in Milwaukee. In 1999, he established and led a dedicated firearms enforcement unit to address high rates of firearm-related death and injury, and collaborated with the Medical College of Wisconsin's Firearm Injury Research Center to identify preventive strategies to reduce them. John developed an early intervention program and worked with advocates and medical professionals to develop the Sojourner Family Peace Center, a national model that combines shelter, therapeutic intervention, and many other services for families impacted by violence. Mr. Chisholm.
Well, thank you very much for the kind introduction, and I really want to thank you, Daryl. And I'm thanking you because, we're coming out of 3 years of just unprecedented disruption to all of the entities in our social fabric, in our communities, that are able to proactively identify problems, try to prevent them, and to intervene. And I liken it to what we kind of seasonally get used to, which is an uptick of violence during the summer. Well, we've in effect been on a 3-year summer is what's occurred. And we have, in fact, seen a direct correlation to what happens when all of those entities that are oftentimes just completely not known, but are just doing the work in silence, but with effectiveness, when they're disrupted, there is a direct correlation with what you see happen with the violence spreading like a contagion. So again, thank you for the introduction. I go back to my experiences as a prosecutor, dating back to when I was an intern in my second year in law school. I was able to do my first work in a prosecutor's office. I point that out in 1992 because, and I will ground this in how gun violence has impacted here in the city of Milwaukee primarily, from my experience as a prosecutor. So in 1992, that was 1 year out from the peak year of gun violence in the city of Milwaukee prior to 2020. 1991. Now, those of you who were here in 1991 will know that in the early 1990s, the homicide epidemic was fueled primarily by two factors. One was tremendous social disruption because the economic foundations were just dramatically changing during the 1980s, and it came to full bear in the 1990s, disproportionately, as always, impacting on poor people of color in our community. And so what we saw then was this acceleration of violence that was primarily fueled by the crack epidemic. And 163, keep in mind, what else happened in 1991 that added significantly to those numbers? 163 homicides. Well, that 1991 was also the year that the homicides associated with Jeffrey Dahmer were discovered as well. I bring this out because in 2020, for the first time since the early 1990s, we surpassed that total. We had 180 homicides, and I have to put that in context as well. I never, ever thought that I would see the day that we would have more than 160 homicides in the city of Milwaukee. I just never thought we would, because collectively, as a community, we had done some incredible and significant work in trying to address that problem. In fact, in the year 2008, we reduced the number of homicides to the same level they were in the 1970s, about 80. That's when we had probably about 50,000 more people in the city as well. So we had actually done so very successfully, and I'll explain some of the things that have changed. But my main point is simply to identify that, yes, there are things that we can do to address the violence. and that there is, in fact, a direct correlation when all of the services that are working collaboratively and sometimes very quietly to try to prevent the rise of gun violence are disrupted or are prevented from doing their work most effectively. So 2020, about 180 homicides. 2021, we come in just under 200, and in 2022, we surpassed 200 homicides. Now, keep in mind as well that I agree, looking at homicides in itself, it is a number that you cannot avoid. You can't massage that number in any way, shape, or form. The number you really want to look at, and we didn't do that in the early 90s, is the non-fatal shootings. The non-fatal shootings have also accelerated. And why is that important? Because medical intervention has changed radically as well. In other words, it's much worse than that homicide number itself, because of the tremendous advances in medical intervention have saved so many lives that otherwise would have been lost. So the urgency is real. How do you explain it? What drives this thing? A couple things have to be acknowledged, and that is that first and foremost, as many of our speakers in the morning rooted their discussions in the trauma that the community has experienced for a long period of time. That is what we encounter in the criminal justice system every single day. Whether you're a victim of violence or whether you're the perpetrator, oftentimes what we find when you dig into the histories of the individuals that are coming into our system, the distinctions become almost meaningless. You know, the person that is the offender has also been subjected to tremendous amounts of violence and tremendous amounts of trauma. The victim in the exact same thing. So what we try to do, to the extent that we can, is to address that, and again, ideally proactively, put prosecutors out into the community to help work with the community to identify problems early on. Work with entities like the medical college and all of the Office of Violence Prevention, the whole array of people here today who have committed your whole lives to trying to improve the quality of life, the health, and the well-being of this community, for which I'm tremendously grateful. We've been honored and privileged to be able to work with you. But the challenge is real, and that's because we have been fed a diet of fear, and when you send that message into a community that's already experienced extraordinary amounts of trauma, and then you make access to guns so incredibly easy. And it's just gotten worse and worse. You know, when I started the firearms unit back in late 99 and 2000, we issued maybe one what we'd call machine gun case at the time. You know, nobody used fully automatic weapons to commit a crime. And the calibers of weapons they used were much lower at that time too. Between 2017 and 2020, we issued 4 fully automatic weapon charges in the city. Between 2020 and the present date, we have issued over 80. Over 80. So you may have seen just recently that the police chief and I kind of reported out to the community about a group of individuals, and that's the best that we can refer to them, because it's driven now primarily by social media. Even the traditional ways of identifying problems being purely geographically centered aren't always true anymore. A lot of this is now metastasized into forms that are very mobile, they're very fluid, and they're very hard to get our arms around. But one thing that remains the same, and that is that we are dealing with individuals that have experienced tremendous amounts of trauma, and they have ready access to firearms. And so what is the number one thing that when we, through the Homicide Review Commission, through our violence reduction, public health, and safety teams, when we analyze what has resulted in a shooting or a homicide, a firearms-related one, what is the number one cause? Overwhelmingly, it's always the same. It's conflict, it's argument. In other words, it's a spontaneous. It's not a gang-related, long-standing feud. It's spontaneous. And if you have all these issues and you have a firearm and you're confronted with a conflict, what's the first thing you're going to do? You're going to pull the gun and you're going to start firing. And when one of those guns has now been modified so that it can be fully automatic, instead of finding 5 casings on the scene, 10 casings on the scene, it is now routine to find anywhere from 60 to 80 to 100. So this is an emergency. So it is an emergency, and we should be pulling together, just as we are right here today. We should, in fact, be pulling together. And again, I thank you. This is the right time to do it. Let's pull together. Yes, I thoroughly, completely believe in the policy change of extreme risk protection orders and universal background checks. But just as importantly, let's do something about the kids in the city of Milwaukee this summer. Let's pull together and make sure that we don't have any more homicides. Thank you very much.